How to complete the service area template. Issuers seeking to offer qualified health plans, or QHPs, including standalone dental plans, or SEDPs, on the federally facilitated exchange must submit a completed QHP application per CMS guidelines. As part of the QHP certification process, issuers are asked to fill out several templates with issuer and plan level data. These templates, along with any supporting documentation submitted, comprise an issuer's QHP application. Among these templates is the service area template. The service area template collects information pertaining to an issuer's geographic service areas by state, county, and zip codes. The template creates unique IDs for each service area defined. These IDs are later mapped to plans entered in the Plans and Benefits template. To download the service area template and applicable instructions, visit the service area webpage of the QHP certification website. This webpage contains more information about the service area section of the QHP application, including tips and additional resources. Before filling out the service area template, download and read the instructions from the Application Resources section. Once you're ready to complete the service area template, download the template from the Application Resources section, open the template, and enable macros. Within the service area template, there are 7 data fields, 5 of which are required to complete the template successfully. The required fields are denoted with an asterisk. When filling out templates in the QHP application, start in the top left corner and fill out fields moving down and to the right until all required fields are completed. Now let's walk through filling out the service area template with sample data. Before you begin, look through the data elements required to ensure you have the necessary plan information to successfully complete this template. To begin, enter the 5-digit HIOS issuer ID you received when you registered in the Health Insurance Oversight System, or HIOS, in the state where the applicable plans will be offered. Then click the Create Service Area IDs button and enter the number of service areas you intend to associate to plans in your QHP application. Click OK. Note that separate service area IDs must be created for your individual market service areas and your Small Business Health Options Program, or SHOP market service areas. Issuers that submit via the System for Electronic Rates and Forms Filing, or SERF, must use the same service area template across all binders, or ensure that no service area ID is repeat across binders. In the first cell, under the Service Area ID column, use the drop-down to select one of the service area IDs the template generated. In the next column, enter the service area name that will be associated with the service area ID selected. Note that dual product issuers must use the word dental in this field for any dental service areas to distinguish them from medical service areas. In the state column, indicate whether this service area applies to the entire state. If you select yes, the 2 fields to the right will be grayed out for this row. If you select no, move to the county name column and select the county the service area applies to. If a service area includes multiple counties, each county will require its own row, using the same service area ID and service area name. The next data element is partial county. This field is used to indicate whether the service area covers only a portion of a county. Note that CMS typically only approves service areas containing full counties. If the issuer requests to establish a service area containing a partial county, it must provide, the zip codes included, a justification stating why the issuer will not serve the entire county, and a detailed description that illustrates why the request is necessary, non-discriminatory, and in the best interest of the consumers potentially affected. If this service area does not contain a partial county, select No and continue adding service areas and counties as needed until all service areas have been entered. If this service area contains a partial county, select Yes and read the dialog box that appears. Click OK to continue. 2 additional fields will generate. These are required for this service area. Enter all zip codes included in the service area in the Service Area Zip Codes column. Use a comma to separate each zip code if needed. If a zip code crosses 2 partial counties, enter the data in 2 separate rows. The final column asks you to enter the file name of your partial county justification. When you name the file, use the following naming convention: issuer ID underscore, the 2-letter state abbreviation underscore, service underscore area underscore partial underscore county. Type the name of this file in the Partial County Justification File Name field. Once these fields are complete, continue adding service areas and counties as appropriate until all service areas have been entered. Now let's validate and finalize the template. Once you have completed the template, click the Validate button in the top left corner of the worksheet. Any data issues in your template that need to be resolved will be displayed. Correct these and click the Validate button again. Continue this process until all errors have been resolved. Once the template is valid, click the Finalize button to create an XML that will be automatically saved in the same folder as the template. The XML extract is the file you will submit as part of your QHP application. If you have questions regarding your QHP application, please contact the Marketplace Service Desk at cms_feps@cms.hhs.gov or 855-CMS-1515. For more information about the QHP certification process, visit www.qhpcertification.cms.gov.